Welcome to the Grattan Institute podcast channel. This is a discussion of one of Grattan's reports. Welcome to the Grattan Report podcast. I'm Megan French from Grattan Institute, and we're here today with Stephen Duckett, Health Program Director for the Grattan Institute, to discuss his report, A Sugary Drinks Tax, Recovering the Community Costs of Obesity. Welcome, Stephen.
Thanks, Megan.
So can you tell us what drove the need for this report?
Well, one of the increasing areas of health problems in Australia is the increasing rate of obesity. Now, about 30% of the adult population are obese. That's have a technical definition is a body mass index of more than 30. And back in the 80s, it was only about 10% were obese. So there's been a significant increase in obesity. And then looking behind that, what's basically driven that is that we're consuming more and our activity is unchanged. So this increase has been driven principally by intake of food and drink, including sugary drinks, the focus of this report.
Okay, so what did your research into obesity and obesity-related policies uncover?
So almost every country in the world is looking at this problem, and they're looking at it from a number of perspectives. What we focused on was the cost of obesity. Many of those costs are actually borne by the individual themselves, but some of those costs are actually borne by the community, by the taxpayer. And we estimated there are about $5 billion costs extra associated with obesity than they were for people who aren't obese. So people who are obese go to the doctor more frequently, they're admitted to hospital more frequently, they have more prescriptions, they are more likely to be on social services benefits. So there are a whole lot of costs from that the taxpayer has to carry. On the other hand, they're also less likely, people who are obese are less likely to be in employment, which means there's less taxation income from them to pay for the other costs that are being incurred. So there's this extra $5 billion a year associated with obesity, and that means you've got to think about whether the people who are consuming food and drinks are facing the full costs of those food and drinks. We looked in particular at sugary drinks, basically water-based drinks with added sugar, and we found that they account for somewhere between 5 and 20% of these costs of obesity. And so taking a mid-range estimate, this consumption of sugary sweetened beverages cost the Australian taxpayer about $500 million, and the people who are consuming that, the obese people who are consuming that, don't know about those costs, don't see those costs, and don't pay those costs.
So what does the report recommend can be done to bring about change in this area?
So we're suggesting that there should be a tax on the sugar content, the added sugar content of sugary sweetened beverages. And we're suggesting that tax should be 40 cents per 100 grams of sugar, and that tax would raise, in the first instance, about $500 million, but because it would lead to an increase in the cost of these drinks by about 18% or so, it would probably lead to a reduction in consumption as well. So in the longer term, the tax might raise about $400 million a year. It would mean that, say, a 2-litre soft drink, a 2-litre bottle of soft drink would go up in price about 80 cents. And this would mean that people who are obese are beginning to pay the full costs, and so they would have to take that into account in their consumption decisions.
And does the report recommend what could be done with the revenue that's raised from this tax?
So there's a huge range of things that could be done with it. On the one hand, you might say, well, we've got a budget deficit and the money should go to budget repair. And on the other hand, on one extreme, you could say, well, you should distribute it to the hospitals, the GPs and so on to help meet these costs. And on the other hand, you might say we want to put it into childhood programs to reduce the incidence of obesity. We don't actually address that, but we just say this is what you can raise from this sort of approach, and the debate about what you actually spend it on is a debate further down the line. But what's actually interesting is many countries are introducing this sort of tax, and most recently, a couple of weeks ago, the time of the American elections, 5 counties and cities in the United States had plebiscites that the public voted on to introduce an additional tax. And what's interesting is every time a country has done this internationally, They've invested in obesity prevention programs at the same time, often directed at childhood obesity.
Well, that all sounds very positive, but will there be any negative impacts to industry or the community if an SSB tax was introduced?
Yes, there are a couple of issues here, Megan. One of the impacts is on poorer people. Poorer people consume more sugary sweetened beverages than richer people. But the impact of this tax overall is about a $6 difference a year between the lowest income fifth of the population and the highest income fifth of the population. Now, this is a very small impact, so we don't think it's got a serious equity impact. But it's also important to know that this tax can be totally avoided, that people can substitute to diet drinks or mineral water, and in fact the overseas evidence is that's what exactly happens. And also, of course, if the government runs programs, these programs can be particularly targeted at low-income households, and so in the end we don't think there's going to be a particularly strong equity impact of this tax. There also will be an impact on the sugar industry. Most of the Australian sugar grown in Australia is actually exported. More than, I think, 80% or so of Australian sugar is exported. And what we're talking about, the impact on the sugar industry would be about 1% of the Australian sugar which would have otherwise been used for domestic consumption we'd probably need to look for export markets for. Some of that sugar production that's used locally is concentrated, so there might need to be a transition scheme to assist sugar growers.
Interesting. Now, I understand there's been quite a lot of interest in this report. How likely do you think it is that we'll see a sugary drinks tax introduced in the near future?
Well, it is interesting. Practically every country is looking at this. There's more countries being added to the list of countries which already have some form of sugar tax. Within Australia, more and more health organisations like the Australian Medical Association, like the Public Health Association, are coming out in favour of some form of sugary drinks tax, partly because the issue of obesity is so great. So I think there's developing a groundswell that, one, this is a useful thing to do, two, we have overseas precedents, so let's get on with it.
So the million-dollar question, is this going to change the obesity problem in Australia?
This is part of the solution. It is not the solution. As I said, it's one of a range of things that can be done. You also need to supplement it with programs to help people make choices and change their behaviour, particularly children. You need to have local initiatives, going to schools and changing what's in the soft drink dispensing machines and so on. So this is not going to fix the obesity problem in Australia. But what's also interesting is the World Health Organization has said they'd be happy if we just stopped the increase in obesity that's occurring around the world. So the goal is not for dramatic reductions anyway, although that'd be good, but the goal is to stop the increase. We estimate there'd be a small reduction in obesity prevalence as a result of this initiative.
Excellent. Well, thank you so much for your time, Stephen. It sounds like it's only a matter of time before we see some kind of real policy change in this area.
Thanks, Megan.
To download and read the full report, head to our website, and to stay up to date on all of our research, subscribe to our Twitter @GrattanInst or on Facebook, Grattan Institute. Thanks for listening. Grattan Institute is uniquely positioned to bring an independent, rigorous and practical lens to big issues in public policy, with the capacity to talk honestly to both sides of politics. We maintain this unique position through the generosity of the public and our affiliate companies. If you would like to find out more about contributing to our continued independence, head to our website to donate. This has been a Grattan Institute podcast. If you want to hear more, check out our website, grattan.edu.au, or subscribe to our podcasts on iTunes.